there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
And today we're going to talk about male pelvic floor, and men have a pelvic floor.
So super important to remember, males, as Melissa said, have pelvic floor muscles just the same as women have pelvic floor muscles. So this is looking kind of a different angle, but if you're looking up and underneath, you can see all of those beautiful muscles of the male pelvic floor. And the way that male pelvic floor dysfunction will often present is erectile dysfunction, chronic prostatitis, pelvic pain, pain with sitting, for your patients with low back pain, hip pain, any kind of radiculopathy, numbness or tingling in the legs. You want to be thinking about the pelvic floor. And I know, go ahead.
And same urinary, any urinary
Totally.
dysfunctions, bowel dysfunctions.
So for example, when we see, and we've all had them, those patients with chronic prostatitis, they go to the urologist and they're given a month of doxycycline. Maybe the symptoms change, even though their UA and their urine culture was totally fine. They're a little bit better because the doxy has some anti-inflammatory properties. They go back to the urologist. They're like, it's a little bit better. Melissa could never believe this when I would tell her this, because this is what you see in practice all of the time. And then they put them on more antibiotics and nothing ever gets any better.
Right.
Yeah.
So unfortunately, we see these male patients when it's been sometimes years down the road with the same cycle of going to urologists or other providers.
So when you see these patients, think about the pelvic floor, think about helping them with down training, diaphragmatic breathing, and think about referring them to a pelvic floor therapist.
And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and let us know if you have any male patients who you think might have pelvic floor dysfunction.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. You'll also get access to our weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. And we're thrilled to announce that we have launched Beyond the Kegel, the only interdisciplinary AANP accredited online course for NPs and CNMs.
Beyond the Kegel is 6 modules packed with practical information that you most likely didn't get in your training. You'll get videos, templates, patient education handouts in both English and in Spanish, hands-on demos, everything that you need to confidently help your patients with pelvic floor dysfunction. By simplifying the pelvic floor, will improve patient outcomes and your provider experience.
Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.